if we're going to invest the money to hire and train these caseworkers, we need to find out how we can retain them as well.
I agree.
The more experience they have, the better job they're going to be doing.
No, I mean, it makes sense to me if you can retain people and you don't have to spend that money, then in the long term you're getting not only better casework, people who feel better about their job, and you're serving the public better. So,
Senator Stephanie?
I'm sorry.
We haven't made is the importance of the best possible recruiting. The best possible recruiting and hiring practices will definitely lead to better retention and success.
I think we do a pretty good job today, but I'm not going to tell you that there aren't things we can learn and get better from. So we have a very formalized process in that, and we try to do that actively. But we're open to ideas and from everybody about how to enhance that process. It's, as you know, some of the jobs are pretty challenging, so how we can hone and really find people who can deal with those challenges is really critical. And so,
and you need to relate the results of your exit interviews and employee interviews to your hiring practices. For example, if they're complaining about stress, well, then you have to hire people who can cope with stress.
Right.
They have to be interrelated.
Senator Dill?
The bottom line here is that the caseworkers sometimes make life or death decisions.
Absolutely.
That's a lot of pressure. Child abuse is hard to figure out, well, why people would do it, but sometimes it's hard to tell if it's occurring or not. I mean, it's, you know, we have training in it in my profession, and yet we get pulled and all that. So the supervisor basically is to direct the caseworker, give some reassurance, a second opinion, if you will, about a potentially life or death decision. Within that team, there's other caseworkers. Do they interact with each other? You might have a very experienced caseworker, perhaps one who may soon be a supervisor, or maybe capable of it then, but are in that position. Do they collaborate as a team? I mean, sometimes physicians, I mean, if I'm not sure about a case, I will get a consultant, which would sort of be a supervisor, someone, you know, a cardiologist that knows more about that field than I would know, as you would expect. But then sometimes I go to one of my partners, who's also a family physician, who has the same amount of experience and training, but just to get reassurance that perhaps that I'm doing the right thing. Do you have lateral consultations? Do you meet as teams? The model for Scott and White and the Mayo Clinic and Texas Back Institute is sort of a team approach where various people in various fields get together and have a group discussion in terms of an issue. And it's just like everything else. In some child abuse cases, it's very straightforward. There's no question. And then others, you're just not sure. And do you want to take the kid away from a family when, you're not? So obviously, some things are, sometimes I walk in a room, you just know what it is. There's no doubt, et cetera, even for a serious thing. Other times, you either think about it or do tests. So is it always just supervisor to caseworker, or is there what I would call lateral consultation, or do you have sessions where people get together and talk about difficult situations? I mean,
I would say it's this way. First of all, I wouldn't overstate how much that happens at the caseworker level as opposed to supervisor caseworker, because it's clearly more of it, vast majority of it's coming from supervisors. Subject to the ability of workers to be together for unit meetings or training or other opportunities, but we don't do teamed investigations. We have newer workers getting more of that support than veteran workers. If that makes sense, right? You would tend to have somebody supported better during that early stage of their career, as opposed to just throwing them out on a home visit investigation without any support initially. But there's a point at which I would say the nexus of workload and availability hits, and that probably diminishes significantly.
And going back to caseload and pay, even if every patient I saw on a given day, it was very clear to me what they had, and I was sure about the treatment, and it all just flowed in. There's still a limit to how many I can see a day under that situation.
Yeah.
One patient who's really worrying me, and I'm not sure what's going on, or I can't get them to somebody else, that's a lot of stress. And these caseworkers are under the same type of stress, and I don't think there's any amount of money in the world you can pay somebody that if they're going to be in a situation day in and day out where they're having to make life and death decisions, potentially life and death decisions, that you could retain them. They've got to have this backup and reassurance. Now, mistakes will be made, and as it is in my profession, and there's just some things that, and you get beat up in the press about it, that sometimes you're going to do everything right and something bad happens. But and you do, obviously, pay is important. People earn and support their families and pay their bills. But the other thing is, I don't think you could double the salary. But if day in and day out a caseworker's in a situation where they either don't have enough time or they don't have somebody they can go to for consultation to sort it out, I think it's all part of a package. And Chairman Nelson, the surveys for teachers has been the same way. I mean, we want to pay teachers, but a lot of teachers say, the pay's nice, we want it, but the conditions mean a heck of a lot.
I absolutely believe you're right that even though the survey as the SAO survey is constructed doesn't get to it, I would say probably that support for the caseworker, whether it comes from their supervisor or some other source, a peer or a more senior caseworker, is probably a huge factor in their ability to cope with what they're having to deal with. And it's certainly also a great way of imparting knowledge. You'd almost love to do teamed investigations, but you know that you just don't have the critical mass of caseworkers. So the question is, in what circumstances do you deploy that? And is it all with new workers? And they're in training, for a 3-month period before they go into the field. And there is some of that support, as you would guess, during that training period, particularly when they get into the stage of training where they're actually doing casework and going out and participating in interviews and home visits.
Now, in medicine, we have peer-to-peer review. We have what we call mortality and morbidity conferences to go over bad outcomes. When you have an adverse event or something happens, when you've been on a case, that do you have something similar? You said that where you
Yes.
review what happened, and
so at the unit and level above the unit level, the program director level, there is a review in all of those serious type of situations. Additionally, statutorily, citizens review teams exist to look at casework issues and investigative issues, and child fatality review teams exist throughout the state, and then there is a state child fatality review team to look at what caused a child fatality. It's not just abuse cases. Those are looked at across the board, so that the state get its insight.
And the tool there can be not only to point out somebody's mistake and hopefully everyone, including that person, learns from it, but also perhaps maybe to reassure someone that they didn't make a mistake. The
Right.
bad thing happened, but because
That would be really critical, as you know, when you've gotten a child death, for example, in your caseload, and you have the support of somebody looking at it and telling you, you didn't screw up.
Do you give special attention to caseworkers where that happens in terms of supporting them, because it weighs heavily on a caseworker when a child dies, with or without any mistake being made, to use that term?
Yeah, there's those. Yes, sir, Senator.
Yeah. Do you look at the percent of caseworkers where that happens who leave? Is there a higher percentage of caseworkers where there's been a bad outcome for a kid, either a death or an injury, severe injury? Do you lose those people with the one event?
I would certainly say there's going to be a higher turnover rate of those folks. And then there are things like the employee assistance program, which includes counseling and other aspects beyond just those that are done by supervisor and people right in their area.
I mean, like when a police officer has to use deadly force, there's a mechanism, to counsel, because it's not something anybody wants to do, so, and a physician loses a case. I mean, there are people that sometimes sit down with them and help them get through it so they don't leave the profession.
I know that occurs. I don't know how formal it is, and I'll find that out.
Well, and, yeah.
No, it occurs, but it may not be, and so one of those things, if it's not formal, if it's not policy, and if it's not mandated practice, then you may not have it occur always. And so I will find out for this committee staff whether that is institutionalized in both policy and practice and really does occur. I know it occurs in child death situations that there is a formal review process. I am not sure whether it occurs in some other significant activity and is formalized.
Yeah. Thank you, Madam Chair.
Okay. Senator Hudson?
I just wanted to make the point that, I think that because of the nature of the job, that we're always going to see a little higher turnover rate than we want to see.
Yeah.
But, of course, I don't think that should stop us in trying to do everything. And I've been listening carefully, and I agree with Senator Uresti. I agree. We don't pay these people, these workers, enough. And I agree with Senator Zaffarini that we do need to do a better job of recruiting people who want to do this and have the personality to do it.
Mm-hmm.
But the most important thing we must never forget is that these workers are the first line. I mean, they many times have to make a decision about whether or not a child is safe in their home, and sometimes they just get one shot at it.
Mm-hmm.
And yes, they can make mistakes, but we want to make sure they're trained, that they have the personality to be there, and that they are being compensated fairly for doing a very difficult job. And I just wanted to make that point because these people protect our kids, and sometimes they don't have. That's their only chance is to have that first person there may save them from a situation where they're being either abused physically, sexually, or could be killed. And so I wanted to bring the kids to the table.
Good point. Well, and the nature of this job is that it is difficult. I mean, for even in the best of situations, it is a difficult job, and we're going to see a high turnover in this job. It's a difficult profession. We just need to do whatever we can to retain people as long as we can, the good people that we've got that are willing to do this. And we know that the longer they stay in, the more they tend to be able to protect these kids. Senator West?
Where do we get the resources from? Where do we get the financial resources from?
Well, I think the state of Texas pays for this.
Oh, the state of Texas. Okay.
That brings up something interesting that at some point we need to talk about. I don't think resources are our number one problem because we haven't filled all the spots we have paid for. So I think our biggest problem is, first of all, fill in the spots that we've already allocated the money for. Then we can talk about, resources, but right now, am I wrong, Commissioner? I just saw some data that indicated to me that we haven't filled the spots yet that we have allocated through this budget cycle. I think it was about a 12% vacancy.
Right. That does not mean we don't fill positions. That means that we have a 12. Yeah, it's
turnover. So we need to. Our first goal should be in seeking out and retaining as many good people as we can to fill those spots that we've already allocated resources for.
Right. And I'm not going to let us get away from this. If we go back to page 18 and see what the reasons are, and we have a 10.9, 11% of seeking better pay, job security, things of that nature, and then you do a comparative analysis on page 22 with states and contiguous states, you see where Texas is. I mean, I assume that having a 10% vacancy is probably customary given turnover. But if indeed we are saying the first responders are the most critical component of the CPS system, and we want to do all the things that we're talking about doing, ladies and gentlemen, we need additional resources in order to do it. We can't escape that. We can talk around it as much as we want to. Most of us have been in this building, you know, I won't say decades. We've been here for a while. We know what the issues are. We know that we need to put additional resources in it. The question is whether or not there's going to be a willingness to do it. We can talk about this. Obviously, we have to do that and make the best recommendations that we can. But a recommendation is going to have to be to make certain that we're paying these first responders who are so important reasonable compensation given what everyone else is doing.
Absolutely, absolutely. But my point, Senator, is that it's not just more money. We've
I
got to
agree.
do
I
something
agree with you wholeheartedly.
to get good people. We've got to have a support network so we don't have a huge turnover rate. We've got to have adequate training. It's a multifaceted situation. Senator Nichols.
Okay, thank you. On page 22, when you did the comparison of other states, did you also do a comparison, contact Oklahoma, New Mexico and stuff, to see if their unit structure with caseworkers and supervision are anywhere similar to ours?
We did not get into that level of detail for this purpose, but we'll be happy to do that.
Did you also, in doing that comparison, determine or even ask them what kind of turnover rate they have on a caseworker level?
I don't know that we did. I haven't seen the data, but we may have it out.
We do not have to invent the perfect wheel by ourselves. There's a lot of states out there that have a lot of different structures. Some work good, probably some work much worse. You know, an evaluation of how other people are doing it that are successful, so that we can compare our structure and our salary rates to see what would fit best here that we might can try, I think would be very helpful.
That'd be great.
Yeah, it would be great. I'm just kind of surprised I haven't done that.
All I can tell you is this is what we did.
But even though New Mexico may pay 30, even though they may pay 6 or 8% more, 10% more, whatever than we do, or like Louisiana, we have no idea where their turnover rate's higher or lower or anything.
We will shortly, Senator, but I'm not saying that we don't know, but I don't know, and it's not in the presentation, so I'm assuming the answer is we don't, okay? But I hear your point. We haven't done, obviously, a good job on the rural issue for you.
Well, the Senate charge, I went back to the Senate charge since we've been talking. There are 3 things in this charge. One has to do with breakout by rural area. You have no data related to that. It separates it out. Number 2, identify legislative changes. And then it tells what it is about efficiency and quality, improving quality. You have no recommendations that I've seen because I've scanned all the way through this thing. We'll have a recommendation this summer. The third thing of the charge is only 3. It further says identify any legislative changes that could improve the quality of child care. And I don't see any recommendations on that either. So that's 1, 2, 3. So you have nothing on any of these 3 charges? We all came here today?
That obviously is the answer.
That is the charge.
That is not what my understanding, and I'm not blaming anybody, was that we were going to lay out the issues today, and then we would come in later with that information. That may be totally wrong. And I apologize to the chair and the committee members if we got that wrong.
Actually, Senator Nichols, about 5 minutes ago, I went back and while we were having discussions, and I think our discussions are good, healthy discussions, but I did exactly what I went back and looked at the charge and said, we're not talking enough about the charge.
We have 8 of us came out of our districts to be here today.
Yeah.
To go over this. Our staff's here, other people are coming to testify, and we have no recommendations on any of the 3 things related to the charge. This is Child Protective Services 101 or 201 or whatever. That's interesting, but we're not going to be able to solve these problems if we don't come up with recommendations. We don't have to create a perfect wheel all by ourselves. There's other people out there in other states that have done things. Okay, thank you.
You're right. You're right. I think we need to zero in on the charges. It's been very good, helpful information, but we need to zero in. So let's pick up, and we are way past what time we've allocated for this particular
I just will
presentation.
comment on the last section, and then I'm not going to go through it in the interest of time. But what we list beginning on page 29 are what we call quality of care collaborations, and these are activities that either we have undertaken or have collaborated with other groups on various issues to try to improve the quality of care for the kids, the children that we are responsible for in the CPS program. And in the interest of time, I won't go through, but we've talked about minority adoptions and the type of activities we're taking and various other projects, our work with the Permanent Commission of the Supreme Court on Children, and various other projects here that we have engaged in. And I can assure the committee we will get you the other information that all of you have identified as critical needs, including our suggested actions related to the charge, Senators.
Let me ask you this, going back to the specific charge. It ends with the phrase, including improving permanency outcomes. And we haven't had too much discussion about that, but I do understand that we may want, there's a lawsuit that's taking place, and we may want to have a further discussion at a later point, from my understanding.
The children's rights laws?
Right.
We'll be happy to do that.
Right. Okay.
Whenever you want, just let us know how you want to do that and what dates you want to do it. We'll be glad to do that. And I'll, although it was here, we have a separate item on the agenda for foster care redesign update, and I assume that's later in the day. And so I'll hold off on saying anything about foster care redesign until we get to that point.
That's a different charge, different discussion. Any other questions right now of the Commissioner? Senator Rossi. Sure.
And I went back and read the charge, but I do think the issue of prevention should be the underlying theme, if you will, to all of the discussions that we're having, whether it be on discharge, on foster care redesign, et cetera. So, Commissioners, we go forward, as you know, and I've said this a million times, we spend less than 1% of the total budget on prevention, which doesn't make any sense. None. But it's definitely a discussion we're going to have going forward, because we'll never solve these problems, ever solve these problems if we spend 1%. And as you all know, last session we cut prevention services by 44%. So the 1% we were spending, we cut by 44% last session. So something to think about. We've talked about that before in my office, but I would encourage this committee, Madam Chair, to have that discussion.
Senator, as a longtime member of this committee, you know that our theme is prevention is the solution. And I think that in our committee recommendations for the solutions to our charges, you're going to hear prevention recommendations a lot across the board for, I can't think of a charge that this committee has, that prevention isn't going to be one of the solutions that we propose. Okay.
Madam Chair, you asked during the discussion, there was some information requested. I'll give it to you verbally now. As part of the functional units, we have the admin tech or the human service technician, which we call case aides. The numbers on those, total numbers statewide, case aides would be, or I'm sorry, I'll call them human service technicians because that's what the other page says, 487, admin techs, which are support staff, 593, and the other information I did not have in the presentation, caseloads for fiscal year 11, and we're waiting, we'll have the first quarter of 12 data available, within a week or so. The investigative caseload was 27.4 cases. The family-based services, 16.9, and the conservatorship caseload, 32. That's an ongoing caseload, so it's less intensive perhaps than investigation, so that's why it would be significantly higher. So those are the data, and we'll obviously get you more information.
Any other questions, members? Commissioner, thank you. Stick around. I think we're going to be having you back up here for some discussion. We're going to now call a panel of 3 individuals. Sandy Barber, representing the Executive Director of the Fannin County Children's Center, Jane Burstein, Senior Policy Analyst at Center for Public Policy Priorities, and Madeline McClure, Executive Director of Text Protect. And I would ask all 3 panelists, we've run way over what time we have allocated for that first presentation, and I don't want to lose senators before we have an opportunity to have all of our discussions. So if you all would keep your comments concise and to the point, that would be very, very helpful for all of us. So let's start out with Sandy. You want to go first?
Thank you very much. My name is Sandy Barber. I'm the Executive Director of the Fannin County Children's Center. I've been there for 11 years. We're located in Bonham in the Senate District 2 with Senator Jewell's district. And I wanted to talk today about the supervision of workers in the rural areas. As Commissioner Baldwin explained, workers are in a unit where there's a supervisor, about 6 or 7 workers, and a case aide and a secretary together. And I wanted to kind of talk to you today about how that really looks in a rural area. In Fannin County, we have 2 investigators, and they are each supervised by different supervisors located in Greenville, which is about a 45-minute drive to the east of us. The rest of their unit is also in Greenville. All the other caseworkers, their supervisor, case aide, everybody's in that office over there. We have 2 conservatorship workers, and they are supervised by one person who, at the time, right now, is located in Sherman, which is about a half-hour drive to the west of us. At times in the past, they've been supervised by a supervisor in Plano, which is about an hour south of us. So they kind of get bounced back and forth. Sometimes they're supervised by somebody in Plano and sometimes in Sherman. We also have one family-based safety service worker, and she currently is supervised by somebody out of Sherman. And that unit that she's in, the workers are spread out in Hunt County, Fannin County, and Grayson County, so they're spread out in 3 counties. What this does is it presents a lot of challenges for the workers. We have both a CASA program and a Children's Advocacy Center at my location, and so we see both the investigative side as well as the conservatorship side. And what I have found is that, bottom line, is the workers and supervisors do not see each other very often. Probably at most they see each other about once a week, so it ends up being maybe 1 to 5 times a month that they see each other. And the other thing is, in order to see each other, they have to spend 1 to 2 hours round trip just to get to the same location as each other. And that amount of time could so much better be used working cases, getting caught up on paperwork, returning phone calls, those sorts of things. So there's a lot of time wasted that way, as well as the mileage. I don't know how much money is spent by the state of Texas paying these supervisors and workers to get together to see one another, but I have to believe it's a lot. But bottom line, too, what we see is that the workers feel rather isolated. They are not there with the rest of their unit. They do not see their supervisors very often. Senator Jewell talked about peer support and being able to talk to people that are your peers or that maybe have more experience than you. And I have seen that that can be a real benefit. But when the rest of your unit is 45 minutes away or half hour away, you don't get that benefit. You feel pretty isolated. Trying to even keep the office staffed and having somebody there is an issue because all of the workers are out in the field, and without a central supervisor to coordinate who's going to be in the office to take inquiries that come in through the door, a lot of times there's nobody there because everybody's out. And also, too, I've seen that the workers can really feel overwhelmed when they're trying to do a removal. In the past, in our office, we used to have one supervisor who supervised the investigators and the conservatorship workers and the FBSS workers. And when a removal would happen, the supervisor would call a meeting and get everybody together, and one person may start working on the affidavit and go get that judge, find the judge, get that signature. Another worker would take care of filling out the paperwork needed to get that foster home located. Another worker might be dispatched to the home or to the school to pick up the children, get some belongings, go to the Rainbow Room to get more belongings. And so it was a real team effort to do a removal. But now with the structure that we have, that all those tasks are charged to one person, and they have very little support from the rest of their unit when they need to do a removal. And there are a lot of things that need to be done in that first 24 to 48 hours, and it's all dumped on one person. I think, interestingly enough, when we've had a shift to this type of supervision in our community, we saw a dramatic drop in removals. And I think the management structure was probably a lot to do with that, because in the past they could support each other and help each other out, whereas now they don't get as much of that support. And finally, too, the challenge, I think, is that these supervisors really struggle to get to know the outside agencies, the CASA programs, the children's advocacy centers, the courts, law enforcement. These supervisors do not spend much time in our community, so we don't see them, so it's hard to build a working relationship because of just we need to spend more time with each other. I easily will go 1 to 3 months without seeing the supervisor. I've gone as long as 6 months without seeing the supervisor. And it's no fault of their own, and let me clarify, they've got a difficult job, like you mentioned earlier, and it's just the structure. They're dealing with it the best they can. They have a good attitude about it even. They try to make the best of it, but I can see that it really wears on them. And obviously the solution, I think, would be to go back to the way we did. Earlier, Commissioner Baldwin talked about a waiver. That was something I was not aware of until this hearing today. And I think a lot of people within CPS may not be aware of that because I have talked about this issue for a long time with supervisors and program directors and regional directors, and I know that they all realize that it presents a lot of extra challenges to an already difficult job. But I think that waiver situation sounds like a possibility. But I think that definitely keep the specialization in the urban areas. There's definitely benefits to it, but I think in the rural areas, that specialization can really, the benefit doesn't outweigh some of the challenges that it presents to the workers.
You heard our discussion about technology.
Yes.
Do you believe there are ways to better use technology to alleviate the burden of distance on the caseworker and supervisor relationship, video conferencing, whatever? You heard the discussion. Are there any other suggestions you could make to us?
I wouldn't really have any other suggestions. I think there is that technology there. All our workers have the computers that they can take with them and things like that, and I see that they use that a lot. But I think that we need to remember that that doesn't take the place of
a human support network.
It really does. Personally, I have staff that I supervise, and during the course of the day, they will come in and out of my office several times just needing to talk about a case or talk about a situation. And when I'm away from the office like I am today, there are probably several times today that they will think, ooh, if Sandy was here, I would go talk to her about this. But because I'm not here, they'll think, oh, it can wait till she gets back. I'm not going to bother her with a phone call or a text message. I'll just hold on to it. By the time I get back, they may or may not remember that. So they are, they always think twice before they call me when I'm away from the office. And I have to think that the caseworkers are the same way. Do I really need to call my supervisor and buzz her about that? But if she was just down the hall, hey, I'll just pop in and say, hey, blah, 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 and talk about this. The other thing I have to worry about is that, the supervisors, if they're there, they can observe and overhear a phone call with a client, or they can observe and overhear a interaction between a client and a family and the caseworker. And if they do that, that's how you can go back and supervise and make sure that things are going well and provide correction or improvements or tell them they're doing a great job, whatever it is. But if you're just not seeing them, I can't imagine seeing my staff only 1 to 5 times a month. I just couldn't imagine doing that. This is such hard work. The emotional toll it takes on you, you just need that emotional support to process what happened and, to deal with that. And if I only saw my staff that little, I can't imagine doing that.
Yeah. I think the term support network is one of it.
Exactly.
You've got to have that emotional, especially for the kind of person that goes into this profession. I mean, you need that support network. You heard the discussion, I'm sure, also about the survey that was done, and we've heard the opinion that if a caseworker had a good relationship with his or her supervisor, the caseworker would be more willing to put up with other job issues like the high stress or the low pay. Do you agree with that concept? Really?
I really do. And that's where I've seen the difference. I've been here when we did have a supervisor in the office that supervised everybody, no matter what stage of service they worked. And I've seen it where they've been split. and they just don't have as much, I mean, if you don't spend as much time with someone, how can you have a stronger bond? You know, a lot of it is just that time. I mean, sure, phone calls and text messages can be okay, but sometimes those aren't always the best thing either. I texted with one of my staff last week, and turns out we miscommunicated because she misread the text message that I sent. And so
happens in my office all the time.
Exactly. So, I mean, you know, those technology things are good and helpful, but again, in our area, we have pockets of area where your cell phone doesn't work, and, you know, things like that. So, you know, I think it's just, you know, it's something that can be dealt with. It can be adjusted, and it would, I think, give such a benefit in the support, because the support that caseworkers feel definitely keeps them there or helps them think about leaving. And I know it's a big stressor on them, and they have enough stress to deal with without adding that on top of it.
Well, we would welcome, as we continue this charge, any suggestions that you have. I really believe it's people who are in the trenches that are the ones we're going to get our best ideas from. Sure. And so any suggestions you have, I know more pay would be nice. There's a given. But any other suggestions that you can give us for improving the environment for our caseworkers, because we do value them. And I think Senator Huffman worded it just beautifully, that it's all about our kids, and you're the ones that are there protecting them. So one other question. Do you believe we should allow for the generic or blended unit that we talked about, or, I mean, you know, should we require it for our rural areas, or should we just allow for them to make that change? And how would we determine which units would be appropriate for that new structure? How hard should we push on it?
Well, you know, I think it's interesting. I mean, I've talked a lot about it with various workers on the chain of command, and yet changes haven't happened, and yet now I'm finding out that there are methods, and so I don't know if it's maybe they just didn't realize that was available to them to restructure that. But I would think that, you know, definitely they need to do a hard look in the rural areas and see, are there better ways to structure this? And it would have to look at it differently in different areas. But just really sit down and look of, maybe these two counties we can combine and do things, but maybe it's just, you know, we can do this in this one. But really look at it and maybe have some flexibility as far as how many workers are in a unit, because in the time that I've been here, it's varied anywhere from about 5 to 7 workers, sometimes even 8 workers in a unit. So if you give some flexibility even as to those numbers, then that way maybe in this county we have 5 workers and that could be a unit. In the next county maybe there's 8 workers, you know, of various stages, but they could be together. And so give some flexibility there. And I think that, you know, that it really needs to look at the rural areas and see, are we really making the smartest decisions based on just management 101 type of things, to look for, you know, the workers, and how are we best going to support our workers there.
Yep, good. Good testimony. Senator Nichols?
Oh, thank you. Are you in Bonham?
Yes.
Okay. Our family spent several generations there.
Wonderful.
In most of your testimony, I was listening pretty carefully, you emphasized the importance, the connection and communication between the supervisor and the caseworker.
Yes.
And that seemed to be the primary point in your thing, so that separation out there. Do you have any indication in your area what the turnover rate is? You probably saw some of the turnover rates. Is that comparable to what you're seeing in your area?
We have kind of a mixture. We have some workers that have been there. We have one worker that's been there longer than I have. And then we also have other workers that have been there a few years. And then we do have some turnover. We just lost a conservatorship worker. One of the conservatorship worker positions changes out every 1 to 2 years. So we do kind of get a mixture. And that's where, you know, the new worker that we had come in, he did not, I mean, when you're a new worker, you need that time with your supervisor. And so I have to wonder if the fact that his supervisor was a half hour away and he didn't see her very often, did that contribute to him leaving? Whereas the worker who's been there for 12 years, she started out where her supervisor was in the office with her for the first 4 or 5 years she was there. So she's been able to better manage her supervisor being a half hour away or an hour away, because by the time that happened to her, she was a very tenured worker, and she didn't need as much supervision, so she was able to manage that a little bit better. Our investigative workers, we've had turnover every couple of years with them.
And the number of cases per caseworker in your area is about what?
It varies. For a little while, our conservatorship worker had to take the whole caseload herself while there was that vacancy. And so then that really stressed her out. And
do you have any feel for numbers?
I think she probably has about the 30 cases for the conservatorships. I think she's about average. I think our investigative workers are probably, from what I've seen in the numbers, I think they're around the average number from what I've seen in some of those.
Thank you.
Mm-hmm.
Okay. Other questions? Thank you.
You're welcome.
Go ahead. You.
Hi. Jane Verstein. I'm a Senior Policy Analyst at the Center for Public Policy Priorities. And I've been working in the child welfare area in one sense or another for the past 15 years. And like a lot of people, I started out working directly with children and families. I was an attorney representing children in the child welfare system in Los Angeles, which at the time had about as many kids in care as the entire state of Texas. And so doing direct services work with this population is like being in a small, leaky rowboat with half of a paddle. And you're in a sea of families and children who are drowning, and you paddle as hard as you can to reach as many families as you can and pull them into your boat. But like many who do this work, after about 6.5 years, I became frustrated because my boat was too small and I couldn't get to the families and children who needed help fast enough. So I went back to school, did my dissertation on teenage moms in the child welfare system, and after earning my PhD, came to Texas, and for the last 3.5 years have been working at the center trying to build a better boat for Texas at the national, state, and local level so the people who are still doing that frontline work can reach kids and families faster and pull them into their boat. And I hope you all have my presentation. So one of the things that I wanted to talk about, I'm going to talk about a couple of issues besides turnover. One of the things that you need to build a better boat for caseworkers, and this is on the second slide, slide 2, is they need to have the support that they need to do the job right. And we talked about this, and I'm not going to get into a lot of detail, except to say that in 2005, 2007, and 2009, the legislature really invested in supervisors and administrative support so caseworkers had that relationship with their supervisor, because the supervisor wasn't supervising 10 people, and they had the work that the administrative support they needed so they could spend their time in the field rather than in the office. And the progress we made, unfortunately, has been hurt by the budget cuts from last session. As a result of those budget cuts, CPS had to reorganize its staff, and to keep as many caseworkers as possible, they've, in investigations, there's going to be 37% fewer case aides and administration support, and for those working with families, there's going to be 14% fewer supervisors and 14% less case aides and administrative support. And the reason why I highlight this is keeping the number of caseworkers, maintaining the number of caseworkers may help to keep caseloads from getting high, but if you can't have access to your supervisor because they're now managing 7 people instead of 5 people, and if you don't have the administrative support you need, then your workload on each case has gone up. And so in the end, you haven't made their job any easier, and you may have actually made it harder. And by increasing the span of control for the supervisor, you've made it much more difficult for them to maintain a strong relationship with the various caseworkers that they're managing.
Now, are your numbers, are you looking at authorized positions or filled positions?
That is a great question, and I cannot specifically answer that. My data is from DFPS, and so I'm not exactly sure if those are filled positions. My guess would be that those are authorized positions, but I can't say for sure.
Well, if it's DFPS data, that's authorized positions. And that goes back to my earlier comment, and I absolutely agree that we need to give CPS the resources to do the job right. But it seems to me that we also need to be talking about how to fill the positions that we've authorized.
Absolutely.
I mean, we've provided the resources, and we're not, if you compare fiscal year 11 average filled positions to fiscal year 12 positions, I don't think the percentages are this high. And when we're talking about meeting our needs, I mean, we last session made the decision to prioritize and invest in additional frontline workers. We appropriated funds for, I think, about 200 additional positions, and we're not able to fill them. And part of the problem is the high turnover. And so, while we have this discussion, yes, we need to properly fund CPS. But we got some other problems too. And one of them is, what are we going to do about the turnover rate? What are we going to do to keep good people in? And I think our discussion about, supervisors and just our earlier discussion, all that comes into play. So I want to hear you guys talk about that.
Absolutely. And that is, okay.
Senator Uristi.
Of authorized positions, that's still a high number. Or if it's 37% of filled positions, it's still a high number. What am I missing there?
We have positions that we funded and authorized through our last budget that are not filled. About, 12%?
But doesn't that exacerbate the problem?
Yeah, we have a 12% vacancy rate right now.
But that exacerbates the problem then. If you're looking at 37% of authorized positions that don't have case aids, and admin investigations, coupled with the vacancy rate, you still have a problem.
Absolutely agree. We've got a problem. But we need to be talking about what we can do to fill the positions that we've already authorized. We've already paid for or allocated money for some of these positions that we're not able to fill. We need to talk about that problem.
That is a perfect segue into my next slide.
There you go.
Into my next slide. Thank you very much. So I did a paper that you all should have on caseworker turnover here in Texas that not only explored what it was, but made recommendations. And one of the things that the research shows is, in addition to supervisor support, which is pretty much the number one issue for caseworker retention, if you want to make people stay at the organization, you have to build organizational commitment. And on slide 3, I have several different recommendations, and I'm not going to get into the specific details in the interest of time, as all of those are discussed in detail in my paper. Although I do want to highlight just one of them, and that's creating an internal career path for investigators. Senator Nelson, you talked about the fact that to a certain degree there's always going to be high turnover because it's a difficult job, and I think that's true especially in investigations given the emergency nature of that type of work. And I think one thing that's important is to keep those investigators to the extent you can, if they can't stay in investigations, have a career path and recognize that you may want to retain them as an FDSS worker or a conservatorship worker.
Experience is invaluable.
So, exactly. And that really, talking to investigators about that. If you get burned out, talk to us about ways to stay within the agency in a different role rather than simply leaving. So unless anyone has any specific questions about some of the recommendations I have here, I'll turn to my next slide. So on the next slide, I talk about building unit cohesion and the relationship with the supervisor, which everyone has talked about is really important. And the only other thing I wanted to highlight that was an issue and I think remains an issue is making sure the supervisor is involved in picking the people who are going to work in their unit. When in 2003, the hiring process was centralized, and you have hiring specialists, and that was not just at CPS, but at HHSC overall. And the idea was you could get economies of scale by having people who specialize in the hiring process and take the administrative burden of going through resumes and that type of thing from the supervisors. But what that did was attenuate the supervisor from actually picking the people who are going to be working in their unit. And I know that the department has been working on ways to better balance having a centralized process with involving supervisors, but I think they need to continue to look at ways to make sure that the supervisor has input into the people who are coming into their unit. Because you can meet all the basic qualifications, but your personality may not fit in with the particular unit, and it doesn't matter how good of a caseworker you are, if you don't fit in with the kind of unit culture, then there are going to be problems. And then the last issue that I wanted to talk about as far as improving generally caseworker retention with pay parity among the different functional units. And as you all, I'm sure, know, investigators are paid $5,000 extra.
That extra stipend.
Yes, the extra stipend, and it's not that they don't deserve it, but the problem is when you come in and you're looking at being an investigator, an FPSS, or a conservatorship worker, you may be, if you're a social worker, you may be better suited for FPSS. But when you're looking at salaries and you look, I can make 32 as an FPSS or I can make 37 as an investigator, you may be selecting into investigations, get in there, it's not what you want to do, and if you wanted to transfer to FPSS, you'd lose $5,000, so instead you just leave. Yeah. And so I think that pay parity disparity among the units has to be addressed.
Yeah, okay, yeah, I agree. And I remember when we initially implemented that $5,000 stipend was so we were having trouble recruiting good, sharp investigators. So, and I understand what you're saying, but my question is, without that stipend, how would we continue to recruit and attract our investigators?
Well, I'm not saying to eliminate the stipend. When I say pay parity, I'm saying you need to bring FPSS. You need to do one of two things. You either need to bring FPSS and conservatorship workers up to the same level as investigations as far as pay is concerned, so they're not making a choice based on pay, or you need to structure that stipend in such a way that you don't immediately get that stipend. You stay for a while before you get that stipend, so your choice up front isn't driven by that $5,000.
Good suggestion. Yeah, good. Members, questions? Okay, go ahead.
Okay, so my next slide, slide 5, I want to talk a little bit about the rural areas, and I'm sorry Senator Nichols isn't here because I actually have some data on the rural areas.
I'll make sure he gets.
Specifically, this is by region. So this is from the data books, and I don't have any specific data on counties. But what I did was I looked at the 5 regions that are fairly rural regions and that they don't have any major metropolitan area in them. And what you can see is that the circumstances and the turnover vary significantly depending where you are in the state. And I highlight this to highlight that just as you can't treat rural and urban similarly, not all rural areas are the same. So you can see, for example, the East region, Region 4, actually had turnover decline from 2004 compared to 2011. And then you look at Southeast, Region 5, compared to the West, Region 9, and you see that Southeast is less than half of the turnover rate as West Texas. And so the circumstances in each area is very different. And so even in the rural areas, a one-size-fits-all model is not going to work. And so, Senator Nelson, you had asked about should we work with CPS to give them flexibility as to whether or not to implement this different model where you have one supervisor who manages investigators and FPSS, or should we mandate it? And I recommend against mandating it. I think that the circumstances, even in the different rural areas, are such that you can't have a one-size-fits-all model, and you really have to drill down to the particular communities where the workers are working and figure out what works best.
Looking at these percentages, do you think this is tied with the economy of the region? You know, in West Texas, was it things were cooking because of gas prices, and looking down at East Texas, maybe the unemployment rate was higher there, and they went.
I think turnover is absolutely tied to the economy. It's clear that if you have, when the economy is doing well, either in your region or overall, that you have a lot of choices, and so you may be more likely to leave. You saw that if you looked at the turnover rate, you saw when the economy went bad in 2009 and 2010, turnover overall declined because people wanted to keep their state jobs.
Well, but I'm looking specifically to regions here and seeing there could be some definite relationships there.
I think part of... Sure.
Well, in representing West Texas, I can speak to that. I mean, it's 588 miles from San Antonio to El Paso, which is my district.
Dang.
And so if you have to go to Sonora, for example, I mean, that's a long... Thank you, Senator Hopkins, because I forgot, and it is the largest district in the country, by the way, bigger than 23 states.
I didn't know that.
In 118 countries, actually. And it includes 2 time zones when you get into El Paso. And therein lies my point. It's a huge area, and if you have to get to Presidio, for example, you know, the caseworker's having to go to Presidio, there's no shortcut to Presidio. That could be a 3-hour drive from Bacon. So I think your points are well taken, in that I don't think we can apply a cookie cutter approach to even between comparing West Texas to South East Texas.
Exactly. And the other thing besides just the economy, which I do think in the particular regions drives it, is caseload. So if you look in 2011, the caseload in Southeast, which had the lowest, the investigative caseload was 20. If you look at the investigative caseload in the West region, it was 32.
Good drill down.
Other questions on... So what I'd like to turn to now, if you look at the next two slides, is really talk about quality of care and outcomes. And in order to understand how CPS operates, you really have to understand the context of the families that it serves. And the next couple of slides, I think, highlight how difficult it is for families in Texas. 1 in 4 children live in poverty. 1 in 3 children live in single-parent households. 1 in 6 kids do not have health insurance, and 1 in 3 parents don't have health insurance. And I highlight this because that means that if you have a substance abuse problem, a mental health problem, if you don't have insurance, you're not going to get treatment, because Texas has a very small community-based mental health system. On the other side, Texas has a very high rate of teenage births, and we don't stop at 1. Texas has the highest rate of repeat teen births in the nation. We have virtually no child abuse and neglect prevention. In a state of 1.7 million children in poverty, we have capacity to serve about 5,000 kids with our child abuse and neglect prevention programs specifically. And then, as everyone has mentioned, a large part of Texas is rural, and Texas has the largest share of the population in the nation living in rural counties, which means people are more socially isolated and they have less access to services. If you look over on...
Excuse me.
Yes.
And this is a larger discussion, but do you think these statistics is the fault of the Texas government?
In part, yes.
Tell me why.
Because I don't think that the Texas government appropriately funds services to support struggling families.
So would you take the position that with more funding, all of this could be changed?
I would not take the position that with more funding we could eliminate poverty or we could provide health insurance to everyone, but we could help ameliorate it, yes. If you look at other states that have higher rates of funding, they have lower poverty rates.
Well, the decision for people to have children when they are in poverty, that's an individual decision, right?
It's absolutely individual decision, but part of the reason, from my experience in working with these families, that they make those choices is because they don't feel that they have any other opportunities. I promise you that if you give teen girls, and I've worked with a lot of teen moms, if you give them actual opportunities to do something besides have children, they will take it. The reason they are having children, for the most part, is because they feel they have no other opportunities.
Is that what you did your dissertation on? You said something about...
Yes, I did my dissertation on outcomes for teenage moms in the child welfare system, so I specifically looked at whether they were more likely to reunify and if the type of placement affected and was related to the reunification outcome.
And the 1 in 3 children in single-parent households, that's because of either divorce or illegitimacy. We can intervene and stop that?
I believe that if we have services to help families, part of what I think drives people to have children when they may not have the appropriate resources, like I said, is a lack of opportunities. And I think resources to support families, even if they are single-parent families. I highlight these not to say that being in a single-parent family means that that in and of itself is a bad thing. There are plenty of single-parent families that do really well. I highlight these because all of these are risk factors for abuse and neglect. That's why I highlight them.
No, that's fine.
And spending services, I think, to support struggling families, whether you're in a single-parent household or you're poor, is going to help ameliorate that risk.
Yes. And in terms of 1 in 6 children having no health insurance, and then 1 in 3 parents, I assume that discrepancy is because of Medicaid and CHIP.
Yes, the parents are not eligible for Medicaid and CHIP, and the children are.
Yeah. And Do you see the lack of health insurance as something the state's not doing?
Yes.
And what would that be?
Well, I think that the state, with respect to children, provides Medicaid at the lowest level. So basically, the federal government for Medicaid, as I'm sure you know, has minimum standards of who has to be covered, and the state has, in essence, chosen to stay at those minimum standards rather than, like some other states, actually provide Medicaid to children who are above those minimum standards. And with respect to the parents, the state has chosen not to provide Medicaid to poor parents.
And you think it's the responsibility of government to provide health insurance to people that don't have it?
I think if you want to help avoid abuse and neglect, one of the ways you can do that is to provide health insurance to the parents, yes.
So, well, a neglect would be not taking a child for health care if they needed it. Where would the abuse fit in there?
Well, the abuse, when I say abuse and neglect, part of the abuse and neglect would be getting appropriate mental health treatment. If you don't have insurance, you can't get appropriate mental health treatment. And a lot of the abuse and neglect is driven by substance abuse, and studies have shown that when you can't get appropriate mental health treatment, a lot of people medicate with illicit substances instead.
Well, we have a pretty extensive MHMR system in the state. Is that not helping?
Well, it's not helping enough. Our community, actually, Texas ranks 50th as far as spending per capita on mental health services.
Okay. And then the teenage pregnancy, is that related to education? In terms, you said, of giving them a choice, although the teenage pregnancy rate still is high even in the more affluent areas of the state. Are you talking about educational choices, or what, that we prevent teen pregnancies? What relate that to? Is that to education? Is that our education system failing them, or our job market failing them?
I will be honest with you, I am not an expert in teen pregnancies in general. I will say that from my experience in working with the girls in the child welfare system who got pregnant, a lot of it was a lack of feeling like they were part of a family, so they wanted to create their own, and a lot of it was a lack of what they perceived as opportunities. If you feel like you're never going to have the opportunity to be married, you're never going to have the opportunity to get a real job or go to college, then quite frankly it makes sense that you would get pregnant.
Okay, so you deal more with the outcomes, so after the fact.
Yes, I'm not an expert in teen pregnancy.
That's fine. I'm just trying to so if the outcome after the teen is pregnant, then it becomes a matter of educational opportunities, or
I think
is it a better outcome, or is it?
Yes, I think a lot of it has to do with, one, supporting the teen mom so she has the resources she needs to take care of her child, in addition to educational opportunities and showing her that there's a reason to put off having children, that there's something better. And
then that becomes inordinately much harder if a second child comes along.
If you're a teenage girl and you have a second child, in my experience, your chances of getting out of that are pretty much zero.
Yeah, which is why we did that bill about letting girls 16 and 17 have access to birth control without parental permission, because that's...
I think birth control is an important aspect of it as well.
Statistics there, and these are... Did you have the 16, 17-year-old girls, I mean, or the teenagers, are they pretty much on their own, or do they have...
Well, once again, I just worked at the ones who had been removed from their parents, and so who were in the child welfare system. That's my experience. And so in that sense, most of those were in foster care, and so didn't have a real family that they were a part of.
Yeah, so really they were making their own decisions about the kid and themselves and trying to find a way to get out of it.
Yes, and like I said, I think when you don't have your own family, you try and create one of your own.
And then the other 80% of Texas is rural, with the Metroplex in the Houston area, and then look at Austin and San Antonio. I know our land is still rural, but...
That's land. So that's 80% of the land is rural.
Okay, so we have the largest number, but our percent of people in the rural areas is dwindling. If you look at the redistricting,
that is absolutely true.
I mean, the fact was the rural areas were losing, but nonetheless, people there. Okay, thank you.
Senator West?
Thank you, Madam Chair. And I think that the discussion that Senator Dewey question that Senator Bill just had was very appropriate. If Texas does not address these issues as best we can from the government standpoint, because government can't do it all, but if we don't address these issues, what will be the impact on the future of the state of Texas?
Well, if we don't address the issues, you're going to have more children who are going to be abused and neglected. You're going to have children who aren't going to be educated. You're not going to have an educated workforce, and I think it's going to have a significant impact eventually on the economy of Texas. If you don't have children who are educated and who have opportunities for higher education, not just their secondary education, then eventually that plays out in the economy. Companies don't want to come to a place where there's not people that they can hire to do the job.
And we will continue to have a need in order to increase the services that we'll have to provide for individuals with these problems, which exacerbates the problem that we currently have.
Yes.
In terms of funding.
That's absolutely right.
All right, so it's kind of a pay me now or pay me later.
Yes, how I always say it, especially with respect to the child welfare system, is you're going to pay for these kids one way or another, and you're going to pay for them now. It's a matter of what you want to get for your money and how much you want to pay.
So in an instance that we know that, and the literature is replete with examples, that if you have kids that are in poverty, that positively correlates with dropouts, with juvenile justice issues, criminal justice issues, a whole host of issues that we as taxpayers must, in many instances, subsidize in order to help ameliorate or incarcerate those individuals, right?
Yes.
Okay, so it's an issue of pay me now or pay me later.
Yes.
Thank you.
Might be an issue if you build a school or you build a prison.
Exactly.
Hire a teacher or hire a prison guard.
Senator,
how do
you
want to
ready?
spend your money?
Exactly.
Yeah, and just to kind of follow up on